Welcome to the Holistic Psychiatry Podcast. I'm Courtney Brown Snyder, a physician and holistic adult and child psychiatrist. Today I'm going to talk about how we can think differently about our symptoms and our body systems in a world in which we are compartmentalized into various systems within our body, and bring home this idea of all is one. So this is a very right brain perspective that says that everything in the universe is connected, is interconnected. And a left brain perspective would be, categorizing, compartmentalizing, separating. And we live in a world that is quite left brain and has us separate from each other, separate from our natural world. And again, even within our own bodies, we've come to conceptualize our heart separate from our skin, separate from our brain. And not only do we lose this sort of embodied wholeness, we also lose an opportunity to really figure out what is going on with our health. And I'd like to start with a letter. Dear Dr. Snyder, I have been struggling with my health for many years. I've had depression, anxiety, brain fog, and fatigue. I've also had a rash that comes and goes, as well as racing heart, recurrent sinus infections, constipation, and recurrent bladder pain, though I never seem to have a urinary tract infection. Other symptoms that come and go include numbness and tingling in my hands and feet, blurred vision, dizziness, and sometimes I have problems swallowing. I have seen a psychiatrist, neurologist, cardiologist, urologist, dermatologist, allergist, and ENT, or ear, nose, and throat doctor. All the testing I have had has been normal. The doctors tell me I'm fine and suggest that I keep working with my psychiatrist and therapist. My attempts to get help are leaving me more stressed and demoralized. I know you had similar health issues. Can you comment on what helped you? So to start, as she described, she's seen a number of doctors. So I'd like to just start with running through a lot of the medical specialties to give you a sense of just how compartmentalized medicine is. Even Neurology is separate from psychiatry, and I'll talk more about those. We have the ear, nose, and throat specialist. We have endocrine specialists, endocrinologists who address hormones, pulmonologists who treat our lungs, cardiologists our heart. We have allergists, immunologists. We even have rheumatology, which also addresses our immune system when we're having autoimmunity. We have, gastroenterology, urology, gynecology, and we even have the distinction between pediatrics, and all those specialists have their own pediatric version. So child psychiatry, pediatric cardiology, for example. We have internal medicine, which is more of a generalist approach, except they don't see children. Geriatrics specialize in seeing the elderly. Family medicine is more comprehensive and will see people over their lifespan, but often does need to refer out to specialists. We have specialists that work in diagnostics like radiology and pathology. We have treatment interventions such as surgery, and within surgery there's multiple specialties, whether it's cardiovascular surgery, neurosurgery, pediatric surgery, general surgery. There's around 135 medical specialties, so everyone goes to medical school together and then goes off and does their residency training, and then there's even specialists beyond that do their fellowship training. And incredible medical research that's been happening, there's more and more to be learned. And so it makes sense that Specialists are those who know more about a specific field. The damaging effects of that have been that we start to think about our bodies that way. Nowhere is this more apparent than with the disconnection between the brain and the rest of the body. So the brain is impacted by all the other systems in the body, even the musculoskeletal system. The brain impacts all the systems of the body. And even the brain has been separated into neurology and psychiatry. So I'd like to give you the definition and symptoms that fall under the realm of neurology, and then do the same for psychiatry. And I will explain why my preference as a functional and holistic psychiatrist is to use the term brain symptoms for what I do, and I think it will, or hopefully will, become evident. So neurology is the field of medicine that addresses disorders of the nervous system, including the brain, the spinal cord, and the nerves. Psychiatry also involves the brain and the nerves. Examples of neurologic symptoms include motor symptoms. So this could be muscle weakness, paralysis, tremor, coordination problems, tics, dystonia, which is involuntary muscle contractions. Neurology involves sensory symptoms such as numbness, tingling, pain symptoms, vision changes, hearing loss, altered taste and smell. Seizures are under the realm of neurology, loss of consciousness, speech difficulties, and neurodegenerative disorders. So neurodegenerative, just like it sounds, the degeneration of nerves or cell death, nerve cell death. And this is as in Alzheimer's dementia, Parkinson's disease, and ALS. So if neurology is of the brain, then what is psychiatry? Or the definition of psychiatry is the branch of medicine concerned with the study, diagnosis, and treatment of mental illness. And I'll explain why I tend to avoid the term mental illness, and I think it'll become evident. Mental, definition of mental, is relating to the mind. So is it our mind that's ill, or is it our brain that's ill or not functioning properly? The definition of the mind is the element of a person that enables them to be aware of the world and their experiences, to think and to feel, the faculty of consciousness and thought. So based on these definitions, psychiatry relates to how we feel and how we think, but psychiatry also relates to how we behave. So if someone has severe hyperactivity or severe impulsiveness or behavioral addictions, such as gambling or shopping or substance use addictions, these are behaviors. So feelings, thinking, and behaviors. But for me, this idea of mental illness sort of suggests that we have a degree of control over psychiatric symptoms, which I'm about to list. Now, some of these, certainly in the more subtle versions of them, yes, we can control how we feel, how we think, and how we behave. But in these more extreme and states in which our functioning is being impacted, and that's when we move more into the realm of a disorder or an illness. So psychiatric symptoms will fall under, I'll list the emotional type symptoms, the thinking state type symptoms, and the behavioral type symptoms, sensory symptoms, and then there's some that don't neatly fall in any of those categories, but nonetheless fall under the realm of psychiatry. And as I list these, keep in mind that it's severe, persistent, affecting someone's functioning. And yes, there's a lot of gray here. And this is subjective. What is feeling depressed or sad to one person might be very different for another. But even though it's subjective and there's a lot of gray, that doesn't mean that we need to throw out psychiatry. We need, to the best we can, a language with which to communicate about such things. But we don't have to take a left brain all or none approach. We can recognize that there is nuance and still be able to help people in their healing and thriving. So the symptoms include sad, depressed, irritable, or angry mood. Again, severe, persistent, and affecting functioning. And there is a recognition that's, for example, if someone's just experienced a loss, those symptoms could be severe. They could persist for a while. They could impact someone's functioning. So there's other things that need to be considered. Apathy, lack of feeling, lack of enjoyment, nervousness, worry, fears, phobia, social discomfort, which could be like shyness, difficulty being around people, poor stress tolerance, panic, feelings of overwhelm, inability to relax, feeling tired but wired. I had a patient once use that term, and I found it so fitting for many people that I see. So I'm putting that one in there. Mood swings, mania, attachment-related anxiety. So anxiety more in the context of relationships and fear of abandonment. Fatigue doesn't really fall great under emotions, but nonetheless, that's a psychiatric symptom. And then symptoms related to thinking, inattention, poor concentration, brain fog, problems with memory, obsessions, ruminations, delusions, which are false beliefs, depersonalization, whereas when we feel like we're outside of ourselves. Derealization is when we feel like things in the world around us aren't real. Dissociation is like when we've lost touch with the present moment. Nightmares and flashbacks, that could be from trauma. Learning difficulties fall under the realm of psychiatry, but not necessarily fit well in the realm of thinking. Behavioral symptoms, compulsions, so feeling you need to do something over and over again. Impulsivity, not thinking before we act. Hyperactivity, behavioral difficulties such as what's often referred to as oppositional defiance. I don't care for that term either, but it describes a child who often is anxious and it's being manifested as pushing buttons, arguing, or instigating arguments, doing the opposite of what they're told. Behavioral addictions could be shopping, internet, could be related to eating. Substance use disorders could involve addiction or abuse of substances. Problems with social interaction could be related to shyness or what's called theory of mind, which involves putting ourselves in someone else's perspective. So that, and this is inability to do that well, can be consistent with autism spectrum type symptom. And then sensory type symptoms, that's the fourth category, could be hallucinations, hearing or seeing things that aren't there. Sensory processing issues, problems with bright lights, loud sounds, sensitivity to touch. There can also be sensory seeking that we see with some children will be very physically oriented to running into people and being overly physical in an attempt to get sensory stimulation. So most of these symptoms relate to too much or too little communication between nerve cells. And the way a nerve cell communicates with the next nerve cell is through the synapse, the space between the nerve cells. The first nerve cell has an electrical impulse that goes down it. When it reaches the end, that nerve releases a neurotransmitter, so a chemical, that then binds to a receptor on the next cell, and then the impulse travels down that cell, and so on. And this is going on all over the brain and nervous system. And the neurotransmitters are things like serotonin, dopamine, norepinephrine, which is like adrenaline, GABA, which is calming, and glutamate, which is an excitatory neurotransmitter. And there's others, but those are the more common ones that we talk about. How much neurotransmitter activity in the brain, if it's high, like a lot of activity going on there, we could have panic, mania, hyperactivity. And if it's low, we could have depression, brain fog, fatigue. And how much neurotransmitter activity we have is impacted by many things, not simply how much of a neurotransmitter is available. It's impacted by how many receptors on that second nerve are available. It's impacted by how many receptors there are that actually pick up the neurotransmitters and remove them from that synapse, the space between the cells. It's impacted by the receptor that the neurotransmitter hits is impacted by particular nutrients, sometimes like zinc or magnesium. It could be impacted by estrogen, depending on the neurotransmitter. It could be impacted by histamine, and therefore how much of an inflammatory state we're in. And separate from all of that is we have enzymes in our body, and we have genes that code for those enzymes that are involved in the breakdown of neurotransmitters. So if we have a SNP, so a genetic variant causing a slow enzyme that breaks down neurotransmitters, we could have a lot and not be clearing a particular neurotransmitter well. Separately, we have neurotransmitters require certain nutrients in order for them to be made. B6 is needed to make GABA, to make dopamine, to make serotonin. So if we're low in B6, we could have a lot of problems with the communication for that reason. So I go into this detail to emphasize that biochemically, things could be attributing to these psychiatric symptoms, just as they can be for neurologic symptoms. So it's not uncommon, for example, for someone with Tourette's, a tic disorder, this is a neurologic condition, to have problems with ADHD, so hyperactivity and inattention, and OCD, obsessions and compulsions, and then have two different doctors for neurotransmitter dysfunction. We also, for example, someone could have multiple sclerosis, an autoimmune condition affecting the covering of nerves, and they may be seeing a neurologist for their MS, but then they may have depression or anxiety caused by an inflammatory state. Conditions that I've described are being impacted by the same root causes, as are many conditions in the body and the brain. Separately, with neurology and psychiatry, someone could have memory problems and brain fog and be seeing a psychiatrist, and then at some point they may pass a threshold where they're going into early cognitive decline and then dementia, and then they would be seeing a neurologist. And what that means is that neurologists are seeing the end stages of an illness, and psychiatrists could be seeing the early stages. So neurologists may not know what the precursors, the early beginnings look like, and psychiatrists may not have a deep appreciation of where things are headed. So again, this is problematic. Separate from that is, I would say, in the conventional world, most aren't looking at the underlying root causes to understand appreciate what is fueling the psychiatric conditions. For example, let's say inflammation fueling the psychiatric condition that then over time leads to cell death and then neurodegeneration. Neurodegeneration doesn't just start when somebody has Alzheimer's. It started 20 years at least earlier. And if we thought more holistically about the lifespan, the course of illness, and the body and brain, then we would be able to recognize these patterns more easily. Hope would be that we could have this bigger picture, this bigger right brain picture of ourselves, and that we could recognize that when we're having a symptom, let's say of our skin, it could be very related to the symptom that we're having in our gastrointestinal tract or the symptom that we're having in our brain. My hope, too, would be that there would be less emphasis on specialization and more emphasis. For example, if there were going to be specialties, they would be in the realm of oxidative stress, inflammation, the stress response, including the autonomic nervous system, and that there would be a specialty focused on the microbiome, a specialty that focused on nutrients, and the intersection with genetics and epigenetics, and that all medical schools would be teaching these areas, and that there would be more generalists who are very knowledgeable in these areas, fewer specialists, and again, specialists in these areas, and even these areas are constantly feeding into one another. If that were the case, then when a woman who is having depression, anxiety, brain fog, fatigue, skin issues, sinus issues, bladder issues, GI issues, peripheral nerve issues, they would easily recognize that she's dealing with inflammation because they've had multiple symptoms that she's just described that relate to inflammation, instead of just honing in on the body part that they've been trained in. And once they recognize she has inflammation, they could start to treat her to lower the inflammation, and already her symptoms could be improving while they're identifying why she's having inflammation. My experience, the most common cause of this type of inflammation that she's having, which is probably mast cell activation, would be mold toxicity. We have other biotoxins like B. Lyme or Lyme co-infection, but in what I do, mold toxicity is the most common driver. We also have chemical toxins, metal toxins. They can certainly create their own oxidative stress. And then quickly test her, start to treat. I hope this is helpful to you. Even if you don't have a lot of symptoms, if it simply helps you think about your own health differently, not in a micromanaging, vigilant kind of way, but just holding what you observe and notice lightly and see what information your body is providing you when it is providing you information. If you'd like to receive these in your mailbox each week, please consider subscribing at CourtneySnyderMD.com. There I have information on my treatment practice, my non-patient phone consultations, which I offer nationally and internationally, and I have information about my mentoring groups for physicians and other practitioners. I hope to connect with you in a future newsletter or episode. Until then, take care. Bye-bye.